Mr. Davis. My name is Pastora. I'm going to be the nurse practitioner student that's doing your assessment today.
Hi.
Hi, how are you doing today? What brings you by the clinic?
I have a sore throat.
Okay, can you tell me more about it?
Yeah. Went to the doctor. Got a sore throat. Went to the doctor. He gave me a Z-Pack. Been on Z-Pack for about 8 days. I have a couple pills left, but nothing seems to be getting better.
Okay.
The only thing the Z-Pack's doing is just giving me some loose stool.
Okay, so you have a little bit of diarrhea.
Mm-hmm.
Okay. Do you have any other symptoms besides the sore throat and the diarrhea?
No.
Okay. How long have you had the sore throat for?
For a couple weeks.
Okay.
I'd say. It's come on kind of slow.
Okay.
I went in, the doctor looked at it, as he noticed some white patches at the back of my throat, swabbed it, thought it might be
Strep throat?
Strep throat, yeah.
Okay.
And then gave me the Z-Pack.
Okay. And when you first noticed the sore throat, did it come on suddenly? Was it over a few days? Or...
Yeah, it came on kind of slow.
Have you had any fevers?
No fevers.
Have you noticed any changes, or have your eyes been bothering you?
No.
How about your nose?
No.
Your ears?
No.
Okay.
Just my stomach. Good.
Okay.
Diarrhea.
Okay. Now I saw from your chart that you also have type 2 diabetes, and you're taking metformin 500 milligrams once in the morning, once in the evening.
Yep.
I also saw that you have asthma.
Yep.
And that you're taking Spiriva in the morning. Do you normally...
And albuterol as
needed. Okay. When you use the Spiriva, are you rinsing your mouth afterwards?
Not always.
Not always. Okay. All right. Also, I did notice that there was notation in the chart that you clench your teeth at night.
Yeah.
Okay.
I do.
Have you noticed if you've broken the skin on the inside of your mouth?
Yeah. Every now and again, I'll bite my cheek.
Okay. Very good. Very good. Now, you said no fevers or anything with your current symptoms, right?
No.
Okay. Have you noticed if anything makes it worse or makes it better?
Yeah. Hot things make it worse. So like warm or hot drinks or food make it worse. The cooler, the better.
Okay. Have you taken any medicine or teas, anything to help it?
No.
Okay. Very good.
Just, Tylenol.
Okay, for the pain.
Teas.
Does the pain move anywhere? Down your neck, down your shoulder, up your face?
Just sticks in the same area.
Is it making it hard for you to swallow as well? Okay. Very good. Have you been around anyone that's been sick lately?
No, not in probably 3 weeks, I'd say.
Okay, very good. All right, so we're going to go ahead and do your assessment really quick. If you have any questions, or if you have, just ask me if I'm going too fast or if something is uncomfortable, okay?
Okay.
Very good. So patient is normal cephalic with no obvious skin abnormalities. Color is pink and moist. Hair distribution is even, no areas of alopecia. Sclera is white. Eyes are properly placed, no obvious deviation of the nose, and bilateral ears are even on his face. Build is healthy, no emaciation. Hair distribution on the arms is also healthy, with no obvious edema. So, Mr. Davis, can you kind of remove your glasses? Thank you. All right, sclera is white, conjunctiva is pink and moist, irises are clear, no opacities. Look in your ears, okay?
Okay.
Outer ear is normal. Tympanic membrane is pearly gray with landmarks visible and cone of light as well. Tympanic membrane is intact. No pain with manipulation of ear. Does this hurt, Mr. Davis, at all?
No.
Tympanic membrane is also nice and a pearly gray. Malleus is present. Cone of light is nice and bright. Ear canal without redness or swelling. Minimal cerumen. Okay, Mr. Davis, I'm gonna look in your nose. If you can please tilt your head back slightly. Okay, no deviation of septum. Mucosa is a beefy pink with proper moisture, minimal edema to the upper turbinate. Okay, Mr. Davis, if you can please open your mouth, stick out your tongue, and say ah. Okay, very good. Um, Various thin and thick patches of a white substance to the soft palate, the anterior arches, and the tonsillar pillars. Minimal of the white plaque to the posterior pharynx. Say ah, Mr. Davis. Okay, uvula with slight deviation to the left. Tongue is pink with no obvious fissures and a thin white film to evenly distributed to the tongue. Can you lift your tongue, please? Rest of oral mucosa is pink and moist. Okay, can you stick your tongue out and move it to the left and out to the right? Proper movement of tongue. Okay, you can go ahead and put your tongue back in, Mr. Davis. And I'm just going to move your cheek open. No other obvious lesions or anything else to the throat. Okay, you can go ahead and close your mouth, Mr. Davis. Lips are pink without any breaks in the skin. I am going to feel for your lymph nodes now, so tell me if anything hurts. No enlargement of lymph nodes so far. Okay. Can you shrug your shoulders just a little bit? Very good. Okay, you can release them. No nodular inflammation or anything. Tender. Very good. Listen to your heart and your lungs just really fast, Mr. Davis. S1, S2 present, no additional heart sounds, thrills, bruits, or murmurs. If you can take a deep breath, Mr. Davis. In and out through your mouth. Good. Again. 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 Last one. Lung sounds clear throughout with appropriate and even excursion of chest. And you said your stomach, you've been having some loose stools, right?
Correct.
Okay. Listen to your stomach just really quick. Bowel sounds present. Throughout with slight hyperactivity to the left lower quadrant. Now, can you tell me if any of this is tender? Not really?
Maybe a little bit.
Okay, and then
Yeah.
you feel that it's mostly because of the diarrhea more than anything. Okay. Bilateral radial pulses are brisk, +2. No edema of upper extremities. Capillary refill under 2 seconds without obvious clubbing or any cyanosis. Okay. Thank you very much. Differential diagnoses for him would be leukoplakia, thrush, or diphtheria, with no obvious shortness of air. I'm leaning more towards candidiasis because of the antibiotics and the inhaled corticosteroids. And yep, and the diarrhea. Thank you.
Thanks.